Hello everyone, I am Dr. Prachee Kulkarni, fertility consultant, Ferty9 Fertility Center. Every day when we meet patients in the OPD, most of the times they consult us for having issue related to conceiving or unable to become pregnant. But sometimes we do come across with patients who have no problem in conceiving but result into repeated miscarriages or habitual abortions or recurrent miscarriages. So what happens in such patients is they may consider that there is no problem in conceiving, but if the pregnancy is not advancing and if the couple is unable to have a healthy live born baby at the end of 9 months, then they should definitely consider visiting a fertility center where all the facilities are there and get themselves evaluated for the cause of this recurrent miscarriages or habitual abortions. So the causes for recurrent miscarriages can be different. And when do we call it recurrent miscarriages? Most of the times, if it is 3 or more miscarriages, it is called as recurrent miscarriage. But what is seen in the studies is if there are already 2 miscarriages or abortions that have happened, the chance of having third miscarriage is again 30%. So it is always better to start evaluation after 2 miscarriages. Also, if the female's age is more than 35 years, then they should also consider evaluating earlier, because after 35, the egg reserve is going to decrease and egg quality also is going to get compromised, also increase risk of having genetically abnormal children because of aneuploidies at higher age. So now coming to the causes of habitual abortions or recurrent miscarriages. So one of the cause for habitual abortion is genetic. So genetic cause means it might be related to the number of chromosomes. So number of chromosomes that the fetus or the pregnancy is having may be either less or more. We call it as aneuploidy. So aneuploidies is also a cause for recurrent miscarriages. Second genetic cause for miscarriage can be some structural problem with the chromosome. So most common is unbalanced translocation. So how do we know this as a cause of miscarriage? Somebody is suffering a miscarriage and still that products or the baby is not being expelled outside, then what we may advise is to get it surgically evacuated in a sterile condition so that we can send that tissue of the baby or the pregnancy for genetic testing. So this genetic testing can tell us what was the reason for this miscarriage. Is it related to any structural chromosomal problem, or it is related to any aneuploidies? So what can we do in such cases? So basic test what we do is parental karyotype. That is the karyotype test of the husband and wife. If the karyotype test is normal, then we may consider offering them IVF with PGTA, which is a blastocyst biopsy, to get a euploid embryo for transfer. Another thing what we may find out at karyotyping is balanced translocation in one of the partners. Suppose if we see balanced translocation, then what do we offer to such couple? Because there's always a chance of this balanced translocation being passed on to the baby in an unbalanced way. So what we may offer them is IVF with PGT-SR. So PGT-SR will detect this structural rearrangement, and we can select a euploid embryo or an embryo with a balanced translocation for the transfer, so they don't end up with another miscarriage. So this was the first cause, which is related to the genetics. Now the second cause for recurrent miscarriage can be related to endocrine disorders. So what endocrine disorders can result in miscarriage, recurrent miscarriages is thyroid disorders. So somebody who's having very high TSH level or very low TSH level, they may also have thyroid autoantibodies, and these patients are known to have habitual miscarriages. Another endocrine cause for the habitual miscarriage is having diabetes mellitus, which is uncontrolled. So if you are having habitual abortions, get yourself evaluated to rule out this thyroid or diabetes issues. So wherein if these factors are corrected, you may have a normal healthy pregnancy. So coming to the third common cause for the habitual abortion, and that can be autoimmune disorders. So what do we mean by autoimmunity? So our body has an immune system, and this immune system helps us fight against the diseases. But sometimes what may happen is our body tries to fight against our own tissue. So these in the form of autoantibodies. So these autoantibodies are produced in different conditions like autoimmune thyroiditis, SLE, which is systemic lupus erythematosus, or APLA syndrome, antiphospholipid antibody syndrome. So these are the, or rheumatoid arthritis. So these are the examples of autoimmune conditions where certain autoantibodies are formed in the body and it may cause habitual miscarriages. So how do we evaluate such patients is there might be some tests which are involved, some thrombophilia profile or the antibodies for anticardiolipin antibody, lupus anticoagulant, antithyroid antibodies. And based on the reports, we may treat the patient with the either with the steroid supplements or with the aspirin tablet and blood thinner injections. So based on the reports, we decide what would be beneficial for such patients. Now coming to the fourth cause for the habitual or recurrent miscarriages, and that is structural or anatomic problem with the uterus. So somebody who is able to conceive, and if the uterus is not able to sustain the pregnancy and may end up with the miscarriage, then the cause we look into is uterus. So usually these structural or anatomical causes are responsible for miscarriages which happen after 8-10 weeks, around 12 to 16 weeks. Another cause which I mentioned is cervical incompetence, but it has to be properly evaluated that the incompetence is because of the strength of the cervix and not related to infections. So we do some test wherein we pass the dilator through the cervix to see if it is passing easily. And such patients we may advise to go for cervical os tightening or cervical circular surgery either before pregnancy or during pregnancy. Now coming to the fifth cause for habitual abortion, which can be infections. So usually these infections are sexually transmitted infections, infections which can be bacterial vaginosis or gonorrhea or chlamydial infection, or sometimes even some viral infection which are also sexually transmitted. So what we do in such cases is if there are any complaints related to vaginal discharge, we do examination. We may send some high vaginal swab for culture, and based on the culture report, we may treat the infections. Also, some patients who have had history of leaking in the pregnancy followed by miscarriage, those patients usually we evaluate for this vaginal infections more often, even during pregnancy. Maybe every third week or something, we can send the vaginal swabs, and whenever we detect the infection on swabs or whenever the patient has complaints related to the vaginal discharge, we treat the infections in time to prevent the miscarriage. So this is about the habitual miscarriages. Hope this was helpful. So if you have recurrent miscarriages, don't assume that there is no problem. You can conceive and sometime it might be just successful to have a healthy baby. You need proper guidance through this, because every miscarriage is an emotional setback. It's a financial setback wherein you have to go through the procedures to again empty the uterus and procedures like DNC. Sometimes we often see that after a miscarriage, the period bleeding has reduced or some infection has occurred, and which has led to permanent damage to the uterine lining. So please don't take these miscarriages lightly. Do consult a fertility specialist. Take their guidance, find out the cause for your habitual miscarriage. And I wish you all the best, and I wish you that you may succeed in your journey of this recurrent miscarriages and have a healthy baby in your hand very soon. Thank you so much.